Good morning. My name is Alan Lewis, and I'm the Virginia Fire Chief and Emergency Manager for the City of Virginia.
I'm Deputy Chief Chad Nickila with the Virginia Police Department.
Today, we just want to take a moment to update you on what the City of Virginia is doing. We're going to start from a national level and talk about the 30 days to slow the spread, which has happened from the national level.
So we've got some stay-at-home Minnesota, our critical services that we'll be talking about a little bit, and then we'll be talking about a little bit of stay-at-home, what should be open, what should be closed, who's essential, who's not, so on and so forth.
So just to reiterate, in the 30 days to slow the spread, remember the first thing on here is to follow the direction of your state and local authorities. That's very, very important, and that's the part that we're going to talk about. Most of you have already heard the importance of staying home if you're sick and the essential services portion of it. But again, it is very, very important to follow some of these directions. So let's talk a little bit about what the stay-at-home Minnesota means.
All right. We're all aware that in the last couple of weeks, the governor of Minnesota decided that, staying at home is going to be the best for the vast majority of us here in Minnesota. But there are some individuals that are considered essential, and there's critical services out there. And there's actually still quite a bit of people that need to go to work every single day, get up every morning, and certainly the shift work between the hospitals and police departments and fire departments, and even beyond that. So just a few that I want to hit on. So all the healthcare and public health departments are open. Our pharmacies, go out and get your medications if you need them. By all means, you're running low, go do that. I did want to mention too that a lot of pharmacies and through your healthcare provider, you can set up your mail delivery of your pharmaceuticals if you need them, all your prescriptions. Obviously, our law enforcement, public safety, first responders are all still out here working hard. Child care, for again, those individuals that do need to work and are essential, by all means, child care is still allowed to be open. The homeless shelters, still a lot of folks in need there. Food and agriculture type businesses, all of our local grocery stores and whatnot are still open and doing business. And certainly in this last week or so, it seems like the shelves are much more stocked, and I want to send out appreciation for those folks for the work that they're doing. The news media, got to keep us all up to date. And this isn't against the news media, but you know what? Don't be afraid to turn off the news once in a while too, just to kind of get away a little bit, because it just hasn't been a lot of good news. A lot of good stories coming out of this with people and what they're doing, but by all means, every once in a while you got to shut off that news. Critical manufacturing. There's an awful lot of things that we need as a society to continue going. We hear about the masks and the respirators and things like that, but certainly there's a lot of other things that are needed as well. And here locally, we have a lot of manufacturers. Water and waste treatment. As long as we're all sitting at home, we all need that good drinking water, and obviously the toilet facilities go without saying. Okay, and our energy, keeping the lights on for folks. All things that are critical services. There's an awful lot of things that certainly are asked to be closed. So anything that's not considered under that essential, by all means. The dine-in restaurants, a lot of folks that own the restaurants have turned to the curbside pickup, where you can call ahead of time, things like that. That seems to be working out fairly well. It's good to see those places open, okay?
I know both of our crews have hit up a number of restaurants in town.
Absolutely.
We want to support our local businesses. So restaurants, thank you. You are considered an essential service.
Yep. And sadly enough, all of a sudden that takeout meal is kind of a treat at this point, because so many people have been cooking at home and whatnot. So by all means, please hop on the internet, check out our local restaurants, see what they have available, so on. Entertainment venues, unfortunately the theaters are closed down, things like that. If you go online, there's an awful lot of the sites that are allowing movies at a cheaper price that you can just download at home, things like that. The gym and fitness clubs, obviously those are closed just because the nature of people being in there and perspiring and breathing hard. But you know what? Get out and exercise, people. Please get out and exercise. I think that's important. And I think we've all seen over the last week or so a lot of families getting out. And this time of year in Minnesota, we tend to finally get outside and do the bike riding and the jogging and the walking and the rollerblading. And it's great to see so many people doing that. Try to stay within your family. Even if you run into somebody just say a quick hello to them from across the street. Don't go up and give the hugs and all that stuff that you would normally do if it's somebody you haven't seen for a while. We'll get to that point again sometime soon where we can do that. And, on top of that, don't have the big gatherings. You just can't at this point have a bunch of friends over to have a big get together and things like that. Social distancing is key. We're pretty fortunate here on the Iron Range so far as this is concerned. But I think in large part we can all agree that's because we have been doing the social distancing. We were pretty fortunate when all that took place. So again, just kind of fall in line. I know you can go to the Minnesota stayhomemn.gov, and you can find the information on what's open and what's not.
Okay. Well, thank you. What I wanted to talk about just a little bit is how this current situation has affected operations here at the Virginia Fire Department. So again, at both fire and police, we want to encourage you to use 911 for emergencies only. There's a limited amount of resources. Fortunately, people have been paying attention to that, and our call volumes have actually decreased a bit. But the emergencies that we are seeing are serious, and they still need our care. One of the things that we've noticed specifically with a bunch of people now staying home is an increase in our fire calls. On Wednesday, we had 7 fire calls. On Friday, we had 6 fire calls. These ranged from alarm activations to actual kitchen fires. So again, be careful what you're heating, be careful what you're cooking. Use that caution. Don't leave your food unattended while it's being cooked, or you will see a visit from us more than likely, and that's not really the way we want to meet right now. As of today, again, it's noon on the 6th of April, just past noon, and we've already had 3 fire calls for the day. So be very careful with that. The last thing any of us wants is a fire right now, but with a lot of people staying home and cooking, that's bound to happen. Again, cooking fires are our #1 cause of fire, and that's something we want you to help us with. One of the other things is, if you do call 911 and it's a medical emergency, one of the things that they are going to ask you is what's called some infectious disease questions. This hasn't been done in the past, but in light of what's going on right now, they're going to ask you if you've had a fever. Please answer these questions appropriately. They help us with the choosing the right set of personal protective equipment, which we've got some here that we're going to show you just in a bit. And they're going to ask you about, headaches, or if you've had severe muscle pain, if you've had a cough, if you've had the flu, and any questions like vomiting and abdominal pain and unexpected bleeding. Please answer those questions appropriately. We had an unfortunate situation not too long ago where somebody didn't want to cooperate and answer those questions because they didn't understand why. Well, all that did is delay patient care. You may see crews roll up to your house, and instead of rushing in, you may get a phone call from our crew. You may get asked additional questions. There may be a bit of a slowdown in care as we determine the right level of personal protective equipment. And choosing the right level of personal protective equipment is based on some of these questions that you answer, and sometimes, we want you to cooperate and answer those questions. We'll talk about that just a little bit more later. But it is important to answer the questions that our dispatchers ask.
Our call volume too has declined certainly a little bit during the last few weeks. It seems like some of the smaller calls that people would call about, and again, they're all still significant, but it just seems like we're not getting them right now. A lot of theft, a lot of shoplifting. So again, if you're hurting, the food banks are still open, things like that. So there are resources available if by chance you're somebody that does need that type of resource. But certainly some of those spikes that we have seen over the last week, and we'll probably continue to see for the shortcoming here, is the domestic disturbances at the residences. People are at home, and they're at home around each other, and unfortunately that just leads to sometimes people getting on each other's nerves. So as much as it's great to see families together and doing things together, sometimes taking a break at home and maybe one person heading out to the garage and cleaning a little bit, and somebody else catching a TV show for a half hour, an hour that they want to watch by themselves isn't a bad thing. The other types of calls that we see a spike in is the mental health calls. People being depressed, and it's very understandable when we've got this type of stuff going on and the social distancing. So, try to be mindful. If you know of somebody that maybe doesn't have anybody that checks in on them regularly, even just a text to them saying, "How you been? How's it going? You hanging in there?" Just showing that couple of minutes of compassion and checking in to make sure they're okay can make a world of difference in that person's life. And also, if you have somebody that does seem to be reaching out to you, because maybe they are a little bit lonely, maybe they have been sitting at home for a couple of weeks straight and haven't had any contact with somebody, taking just a couple of minutes to chat with them or text them back, I think is a huge thing at this point. And by all means, if you know of anybody that is really hurting and needs some assistance, by all means, calling 911, having our officers come down and check on them just to make sure they're okay and at least help guide them in the direction, maybe getting them some help if they need it, by all means, very important. when our officers do respond, some things have changed for us too. And as Chief alluded to, we have this personal protective equipment. Our officers are going anytime to a residence that they're going to speak with individuals. They are wearing the N95 masks. Okay, very important not only for our officers' safety, but certainly for your safety as well if they're coming to your residence. We also recently got these face shields that are going to help protect as well, just in case. It's just an extra barrier there. All very important. So again, don't feel frustrated that these officers are wearing these things when they're trying to speak with you if they have to come to your house. Just understand it's for your safety and for theirs. And just going forward while we work our way through all this madness, these are the types of things that we had to change and adjust as police officers. We're used to wearing vests and things like that. This is kind of odd for us, but our officers understand it's important because, again, they want to be healthy so they can respond and help your families out. And certainly they don't want to get sick on duty and bring it home to their families as well.
And you may see our folks in yellow and blue colorful gowns as well. Same thing, to protect you and to protect the spread, of potential infectious diseases. Regarding personal protective equipment, we've had a lot of great work working with the St. Louis County Emergency Operations Center. We've been supported at the state level. Some of the stockpiles that were at our state level have been released to ourselves, and we've made those available to surrounding, first responder groups, ambulance services, and fire departments. So there's been more phone conferences, Zoom meetings, briefings. We're literally sleeping and breathing COVID-19, and like the deputy chief said, it's a good idea sometimes just to turn off the news and take a break from it, get outside, and just be away from it. We're going to provide you some resources to allow you to be informed about this, but there sometimes comes a point where it's just enough. I do have, and then there's been great donations made. We want to thank the community members that have donated handmade sanitizer, that have donated the mask coverings that will go over our N95s to allow them to go further. And there's so many people, I can't, name everybody, and then the people that brought food, thank you for that too. Our crews definitely enjoyed that. You can drop it off at the police department or the fire department. Give us a call. We'll come outside, ring the bell here outside the fire department. We'll come pick up those donations. They are very much appreciated, and we want to thank you for doing that. It means a lot that you folks have our backs and support us in this time.
Some of the local businesses that have set aside bottles of hand sanitizer or the Lysol wipes or spray or any of that stuff, again, like the chief said, the food that's been donated, all greatly appreciated. Just means officers on that day don't have to go out and try to find a meal or possibly have to go to the grocery store. They're covered for that shift or whatnot. So we do really appreciate it, absolutely.
And this is really a whole of government approach, both our federal, our state, and then we also work with the county as well as our local hospitals. So I have an update here from Misty Rostreth, who is the clinical nurse educator at Essentia Virginia Hospital, and she wanted me to pass on some of these things. So they are accepting donations as well, and you can drop those off at the hospital loading door number 17. So that's, again, Virginia Hospital loading dock, that's door number 17. They will pick up those donations. There is signage posted, and you are requested to call 749-9446. Again, that's 749-9446. A staff member will come out and pick that up for you. And then you can also ring the doorbell. So for testing criteria, because I know a lot of people have questions about that. It's been big in the national news, but I want to talk about it at the local level. The Minnesota Department of Health has categorized some high priority groups for testing, and Misty wanted me to share those with you folks. So if, because of the way that they're doing the testing and some of the constraints they have, ill individuals, residents or staff that live in congregate living facilities, these are the long-term facilities, the prisons, the jails, homeless shelters, they are a high priority group. Dialysis patients, another very high priority group. They will receive priority on the testing list. Hospitalized patients also receive priority. Healthcare workers who are taking care of immunosuppressed patients, and healthcare workers and their ill household contacts. It's very, very important because when we talk about the community spread and spread among household members, we want to make sure that those people are tested. Patients that are 65 years of age and older, we know that you folks are in a very high risk category, so you receive priority testing. patients who have underlying medical conditions, and I won't go through all of those, but if you have an underlying medical condition that would contribute, that would make you predisposed to an immunosuppressed system, or having difficulty fighting against this infection, you're going to get priority testing. And then first responders and those who provide direct medical assistance, that would be those of us in the fire and police department, first responder groups, EMTs and paramedics as well, and then child care providers. So those groups all have priority testing. There's an expanded criteria here, and they just wanted us to let you know that they do have drive-through testing facilities that are located in Fargo, Detroit Lakes, Baxter, West Duluth, and Virginia. It says patients still need a provider order through an e-visit to be tested at your remote sites, and she just wanted to let us know that we're ready to add additional testing sites as needed. So that's really important to get your e-visit first, to get that order in, and then go to the drive-in testing site. And I think we've got an update here from Virginia Parks and Rec.
Parks and Rec. So Brian Silver at Parks and Rec, and all of this would be posted, I'm assuming, on the Parks and Rec Facebook page as well. Just wanted to let everybody know, as far as the parks and facilities here in the city, unfortunately during this time, a lot of it's shut down, but we'll run through a quick list here of some of the things that they want you to refrain from using parks or trails if you're exhibiting any symptoms. So again, if you have that fever, that cough, even if you are not sure if you actually are positive for the COVID-19 or anything like that, by all means, just refrain from using them. Follow the CDC's guidance on personal hygiene prior to and during use of park or trails. Obviously, when you get home, even just taking off your shoes before you enter your house, things like that, washing your hands and everything right after, very important. Prepare for limited access to public restrooms or water fountains for obvious reasons. While on the trails, warn others of your presence, and as you pass, step aside to let others pass, which goes in the grocery stores too. I hear of a lot of people, you try to give each other space, and some people aren't too mindful, so be the one that gives them a little extra room there. Follow the CDC guidance on the recommended size of social gatherings, including outdoor picnicking, pickup sports, and other group hangouts, and maintain proper physical distance at all times. Again, even with playing pickup basketball, you get 5-6 people out there. Basketball is one of those games where you're in close next to each other. It becomes a problem. Some of the bigger cities, they've had to take down basketball hoops and things like that, and we wouldn't want to have to do that. Nice for a couple of people, go down and play some basketball, but just be mindful about it. Consult your local and state ordinances and guidelines for the most up-to-date recommendations on your park and trail use. And again, you can go to the Parks and Rec Facebook page and see what we've got going on here in town. And again, get out, get some fresh air. It's finally springtime. It hasn't snowed at least in 3 days? So
Still early.
We'll see what happens later today, but get out and enjoy it while you can, please.
So for those of you that want additional information, I've got a website here. This is minnesota.gov/COVID, and we'll kind of hold it up there. Again, minnesota.gov/COVID-19. If you're a data nerd like I am, you'll want to see some of this information, and it does give you a better sense of what's going on as far as what your government is doing for you, both at the state level and even down to the county level. As of today, we have, I believe, 16 confirmed cases in St. Louis County. Just again, follow the social distancing guidelines. We are attempting to get additional data which will help us make the decisions that we need as far as regarding personal protective equipment. We're working with the state to try to get more data so we know where the highest risks are, so we can appropriately protect ourselves, and there'll probably be a little bit more to come on that. I want to thank everybody for kind of adjusting to the new normal. We've seen a number of businesses that have had to close. We know that this is a very, very significant financial loss for a lot of you. Your fire department, your police department here continue to work, but we want to recognize that this is not normal at all, and that a lot of people are making some significant sacrifices financially and socially, and just want to say that there is a light at the end of the tunnel. This won't last forever. We'll come out of this, and hopefully we'll be stronger and find out the best in each of us. And again, I've been very impressed with the donations we've received and the support.
Wash your hands. Refrain from touching your face, which is tough for all of us to do, trust me. Take care of your physical health, take care of your mental health. very important during these times.
So from us here at the City of Virginia, and on behalf of the City of Virginia personnel that are working to serve you, thank you, and feel free to call us if you have additional
Absolutely.
questions or reach out. We're more than happy to take that. So thank you.
Thank you.